Howdy everyone, Madam Mateo here, coming at you with another orthopedic special test, and this one is for the knee. It is the posterior drawer test. So this test, what we all probably have learned back in PT school, we all remember it going through the knee stuff. But it was first spoken about in a paper in 1976 by Dr. Jack Hughston, and Dr. James Andrews. And this was a report, and they were talking about how to assess and evaluate the knee with injuries and checking like the stability and any kind of injury to the cruciate ligaments. So that's what it was first spoke about, and let's get in on how to do it. To perform this test, you have the person lying on their back like Mateo is here. Then what you do, you want to flex the knee to about 90 degrees and the hip up to about 45, so right along in this position. Now the researchers did say that you can sit on the foot if you would like. I've seen that. I've seen people just do it standing. But they said you grasp the tibia and you apply a posterior force. And if you have a lot of laxity compared to the non-injured side or the non-affected side, then it is a positive. Now they do kind of put this in here because of how the PCL is, and if you have that rupture, that the tibia could be sagging a little bit. So they said this actually could show that there is a false positive for an anterior drawer test, because they said if this tibia is sitting farther back, you're going to have a lot of play into it, so it could go look like a anterior drawer test is positive compared to the posterior. So they said you do actually kind of have to pull that slack up where it's in line, and then you test it and check that mobility. So just a little tidbit in there. But anyway, that is how you do the posterior drawer test for the knee. So getting in on the research for this test, there were a lot of studies on it, but we're just going to look at a systematic review that was done in 2013. And it looked at 8 studies on the posterior drawer for injury to the PCL. And it found that the sensitivity ranged in these studies from 22 all the way up to 100%, so pretty good test. And only one of those studies spoke about the specificity, which it said the specificity was 98%. Now there's an interesting thing there with that 22%, because that 22% for sensitivity came from the Hughston study, that first study that we spoke about that talked about the examination evaluation. Now, an interesting thing, there is another systematic review that was done in 2003 in which they look at like 5 or 6 studies, and they reference this Hughston study again, but said the sensitivity is at 55%. But here's the thing. If you read the original article, that report that they were talking about, it's a bit unclear, because they were looking at individuals who had they had 50 individuals with knee injuries, and then they also looked at 50 cadavers, so they said amputated lower extremities, and they were checking the PCL. Now, it's not super clear, so you have to figure out the sensitivity and stuff like that. But they said that in that study there was 18 people with PCL ruptures, and only 4 of those 18 actually tested positive when they did the posterior drawer. But there was a couple things. One, these 18 people had acute PCL injuries. So they said, well, this test may not be as good for an acute PCL tear. But they said if you look at it with someone who has a chronic PCL tear, it's going to be positive every time. But also an interesting thing, they said the 4 that were positive out of the 18 had a fall on a flexed knee. So those were the individuals who had a fall on the flexed knee. The other people were through a clipping incident through playing football. They were hit, so they had damage to the medial component of their knee and PCL as well. So just a very, very interesting little thing in that original study, like I said, and they don't even really talk about what they found, like how many, whatnot, in the cadaver. It's a lot. It's interesting. It's tagged down below if you would like to look at that. But they did say it's not as good with an acute injury because it may not be positive, but with a chronic one, you're probably most likely always going to get a positive. But anyway, that is the posterior drawer test. Let us know. Do you use this test? Do you like it? Do you think maybe, again, not using it with acute, maybe using it for more chronic? Anyway, let us know down in the comments below. And as Mateo always says, take care of yourself. Take care of your patients. We'll see you next time.